The video you are about to see is intended to provide you with an overview and basic information about the Neulasta Pegfilgrastim Onpro kit. This video is not a comprehensive review of Neulasta Onpro and does not replace the instructions for use. Please review with your healthcare provider the patient instructions for use included with the Neulasta Onpro kit. Be sure to talk to your healthcare provider about any questions or concerns you may have about Neulasta Onpro. Indication: Neulasta is a prescription medicine used to help reduce the chance of infection due to a low white blood cell count in people with certain types of cancer, non-myeloid, who receive anti-cancer medicines, chemotherapy, that can cause fever and low white blood cell count. Important safety information. Do not take Neulasta if you have had a serious allergic reaction to pegfilgrastim or filgrastim. Please see additional important safety information at the end of this video.
Hi, I'm Natalie. I'm a busy mom of two, a wife, a yoga instructor, and a former cancer patient. If you're watching this, then like me, you may have been prescribed Neulasta Onpro by your doctor to help boost your body's ability to fight infection after strong chemo. I'm here to share my experiences, to give you an idea of what you can expect during your appointment and the following day. Neulasta Onpro is applied the same day you receive chemotherapy and designed to automatically deliver your Neulasta the following day, approximately 27 hours after application. So instead of going back to the clinic for a Neulasta shot, you can get your Neulasta at home or another appropriate setting. The important thing for me was scheduling flexibility and spending more time at home with my family. Neulasta Onpro was the right choice for me and for many others too. My doctor told me that in a key study, Neulasta reduced the risk of infection from 17% to 1%. That's a 94% decrease. Neulasta Onpro includes the on-body injector for Neulasta. You and your nurse will decide on the best area to apply it, either the back of the upper arm or the abdomen. When I had mine, I wore it on the back of my upper arm. It just needs to be applied to the flattest area. If you decide on the back of the upper arm, you'll need a caregiver with you during dose delivery to keep an eye on it, as it's difficult to see. If you decide on the abdomen, it can be applied to either the right or the left side, except for a 2-inch area right around your navel. Your nurse will clean the selected area using an alcohol swab. Then fill the on-body injector with Neulasta. At this point, the status light will flash amber. Your nurse will then apply the on-body injector securely to your skin. You'll see a black line next to full on the fill indicator. The flashing green status light lets you know it's working properly. The on-body injector is now set up to deliver your Neulasta dose, which will happen approximately 27 hours later. Before you leave the nurse's office, your nurse will review some important do's and don'ts on how to look after your Neulasta Onpro. While wearing the on-body injector, avoid traveling, driving, or operating heavy machinery a few hours before and after the dose is delivered. Avoid bumping, sleeping, or lying on the on-body injector or applying pressure to the on-body injector. Avoid hot tubs, whirlpools, or saunas, as these may affect your Neulasta medicine. The on-body injector has a self-adhesive pad to attach to your skin. Do not use additional materials to hold it in place, as this could result in a missed or incomplete dose of Neulasta. If the on-body injector comes away from your skin before your full dose, do not reapply. Call your healthcare provider, as you may need a replacement dose. Do not expose the on-body injector to direct sunlight. Wear the on-body injector under loose clothing. Avoid getting body lotion, creams, oils, or skin cleansing products near your on-body injector, as these products can loosen the adhesive pad. Do not peel off or disturb the on-body injector adhesive pad before your full dose is complete, as this can cause a missed or incomplete dose of Neulasta. You should be given your own copy of the patient instructions for use with your approximate dose delivery time, along with the full prescribing information for Neulasta Onpro. At that point, it's time to leave and return home. Let's take a look at what to expect at home with Neulasta Onpro. From time to time, remember to check the status light on the on-body injector. It will flash slowly until the start of dose delivery, So watch for at least 10 seconds each time you check it. If it is flashing green, everything is working properly. If at any time you hear beeping, check the status light. If the light flashes red at any point, call your healthcare provider right away. To confirm the approximate time you should start receiving your Neulasta dose, just refer to your instructions for use. Your instructions for use also contain the list of do's and don'ts, which you should read carefully. Make sure you are in a place where you or your caregiver can monitor the on-body injector for the entire dose delivery, which should take about 45 minutes. You should avoid activities and settings that may interfere with monitoring. If you have an allergic reaction during the delivery of Neulasta, remove the on-body injector and call your healthcare provider, or seek emergency care right away. Make sure the on-body injector continues to flash a fast green light and that there are no leaks. During dose delivery, you may hear a series of clicks. This is okay. It's really important that you don't remove your on-body injector during this time. When dose delivery is complete, a long beep will sound and the status light will be solid green. After the beep, confirm that the fill indicator is empty. If you hear beeping and the status light is flashing red, or if for any reason you believe you did not receive your full dose of Neulasta, or that your on-body injector is not working correctly, call your healthcare provider immediately, as you may need a replacement dose. Incomplete doses have been reported with Neulasta Onpro due to the device not performing as intended. An incomplete dose could increase the risk of infection. Once you've made your final checks confirming dose delivery, the on-body injector can be removed by grabbing the edge of the adhesive pad and peeling it off. After your on-body injector has been removed, dispose of it as instructed by your healthcare provider or by state or local laws. If I needed Neulasta again, I would ask my doctor for Neulasta Onpro, and I'm not alone. 95% of patients would do the same. I hope your experience with Neulasta Onpro is as positive as mine was. If you need to discuss any aspect of your treatment, please contact your healthcare provider. Now, let's discuss the important safety information.
Important safety information continued. Before you receive Neulasta, tell your healthcare provider about all of your healthcare conditions, including if you have a sickle cell disorder, have had severe skin reactions to acrylic adhesives, are allergic to latex. The needle cap on the pre-filled syringe contains dry natural rubber derived from latex. Have kidney problems. Are pregnant or plan to become pregnant. It is not known if Neulasta may harm your unborn baby. Are breastfeeding or plan to breastfeed. It is not known if Neulasta passes into your breast milk. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. What are the possible serious side effects of Neulasta? Spleen rupture. Your spleen may become enlarged and can rupture while taking Neulasta. A ruptured spleen can cause death. Call your healthcare provider right away if you have pain in the upper left stomach area or left shoulder tip area. A serious lung problem called acute respiratory distress syndrome, ARDS. Call your healthcare provider or get emergency medical help right away if you have shortness of breath with or without a fever, trouble breathing, or a fast rate of breathing. Serious allergic reactions. Neulasta can cause serious allergic reactions. These reactions can cause a rash over your whole body, shortness of breath, wheezing, dizziness, swelling around your mouth or eyes, fast heart rate, and sweating. If you have an allergic reaction during the delivery of Neulasta, remove the on-body injector for Neulasta by grabbing the edge of the adhesive pad and peeling off the on-body injector. Get emergency medical help right away. Sickle cell crises. You may have a serious sickle cell crisis, which could lead to death if you have a sickle cell disorder and receive Neulasta. Kidney injury, glomerulonephritis. Neulasta can cause kidney injury. Call your healthcare provider right away if you develop any of the following symptoms: swelling of your face or ankles, blood in your urine or dark-colored urine, or you urinate less than usual. Increased white blood cell count, leukocytosis. Your healthcare provider will check your blood during treatment with Neulasta. Decreased platelet count, thrombocytopenia. Your healthcare provider will check your blood during treatment with Neulasta. Tell your healthcare provider if you have unusual bleeding or bruising during treatment with Neulasta. This could be a sign of decreased platelet counts, which may reduce the ability of your blood to clot. Capillary leak syndrome. Neulasta can cause fluid to leak from blood vessels into your body's tissues. This condition is called capillary leak syndrome, CLS. CLS can quickly cause you to have symptoms that may become life-threatening. Get emergency medical help right away if you develop any of the following symptoms: swelling or puffiness and are urinating less than usual, trouble breathing, swelling of your stomach area, abdomen, and feeling of fullness, dizziness or feeling faint, a general feeling of tiredness, myelodysplastic syndrome and acute myeloid leukemia. If you have breast cancer or lung cancer, when Neulasta is used with chemotherapy and radiation therapy, or with radiation therapy alone, you may have an increased risk of developing a precancerous blood condition called myelodysplastic syndrome, MDS, or a blood cancer called acute myeloid leukemia, AML. Symptoms may include tiredness, fever, and easy bruising or bleeding. Call your healthcare provider if you develop these symptoms during treatment with Neulasta. Inflammation of the aorta, aortitis. Inflammation of the aorta, the large blood vessel which transports blood from the heart to the body, has been reported in patients who received Neulasta. Symptoms may include fever, abdominal pain, feeling tired, and back pain. Call your healthcare provider if you experience these symptoms. The most common side effect of Neulasta is pain in your bones and in your arms and legs. These are not all the possible side effects of Neulasta. Call your healthcare provider for medical advice about side effects. You may report negative side effects to the FDA at 1-800-FDA-1088. Please see Neulasta patient information. Neulasta injection, 6 milligrams per 0.6 milliliter in a single dose pre-filled syringe for manual use only. Neulasta injection, 6 milligrams per 0.6 milliliter in a single dose pre-filled syringe co-packaged with the on-body injector, OBI, for Neulasta, Neulasta Onpro kit.
Things to know about Neulasta Onpro. See the instructions for use for the on-body injector for Neulasta for detailed information about the on-body injector and important information about your dose delivery that has been written by your healthcare provider. Know the time that delivery of your dose of Neulasta is expected to start. Avoid traveling, driving, or operating heavy machinery during hour 26 through hour 29 after the on-body injector is applied. Avoid activities and places that may interfere with monitoring during the 45-minute period that Neulasta is expected to be delivered by the on-body injector and for 1 hour after delivery. A caregiver should be with you the first time that you receive Neulasta with the on-body injector. If placed on the back of the arm, a caregiver must be available to monitor the status of the on-body injector. If you have an allergic reaction during the delivery of Neulasta, remove the on-body injector by grabbing the edge of the adhesive pad and peeling off the on-body injector. Get emergency medical help right away. You should only receive a dose of Neulasta on the day your healthcare provider tells you. You should not receive your dose of Neulasta any sooner than 24 hours after you finish receiving your chemotherapy. The on-body injector is programmed to deliver your dose about 27 hours after your healthcare provider places the on-body injector on your skin. Do not expose the on-body injector to the following because the on-body injector may be damaged and you could be injured. Diagnostic imaging, for example, CT scan, MRI, ultrasound, X-ray. Radiation treatment. Oxygen-rich environments such as hyperbaric chambers. Avoid airport X-ray scans. Request a manual pat-down instead. Use care during a manual pat-down to help prevent the on-body injector from being accidentally removed. Keep the on-body injector at least 4 inches away from electrical equipment, such as cell phones, cordless telephones, microwaves, and other common appliances. If the on-body injector is too close to electrical equipment, it may not work correctly and can lead to a missed or incomplete dose of Neulasta. The on-body injector is for adult patients only. If your on-body injector is not working properly, you may miss your dose, or you may not receive your full dose of Neulasta. If you miss your dose or do not receive your full dose of Neulasta, you may have an increased risk of developing fever or infection. Call your healthcare provider right away, as you may need a replacement dose if any of the following occur. On-body injector comes off before or during a dose delivery. Do not reapply it. On-body injector is leaking. Adhesive on your on-body injector becomes noticeably wet, saturated with fluid, or there is dripping. This may mean that Neulasta is leaking out of your on-body injector. If this happens, you may only receive some of your dose of Neulasta, or you may not receive a dose at all. On-body injector status light is flashing red.
Thanks to Neulasta Onpro, I was able to stay home the day after chemo, and that made the world of difference to me. It has been my pleasure to share these tips with you ahead of your own experience with Neulasta Onpro. Thanks for watching.
We hope this has been informative. If you have any issues with Neulasta Onpro, call Amgen at 1-800-772-6436 or 1-844-MY-NEULASTA, 1-844-696-3852. For general information, visit www.neulasta.com. This video is intended to provide you with an overview and basic information about the Neulasta Onpro kit. This video is not a comprehensive review of Neulasta Onpro and does not replace the instructions for use. Please review with your healthcare provider the patient instructions for use included with the Neulasta Onpro kit. Be sure to talk to your healthcare provider about any questions or concerns you may have about Neulasta Onpro.